Pompe disease, also called glycogen storage disease type 2, is a genetically inherited condition caused by insufficient functioning of an enzyme called lysosomal acid alpha-1,4-glucosidase, or just simply acid alpha-glucosidase, and it's caused by a mutation of the GAA gene. It's named after the Dutch pathologist Dr. J.C. Pompe, who first described it in 1932. Glucose is used for energy by most cells of the body, and it's stored inside the cells as a compact, branch-shaped molecule called glycogen. When a cell needs energy, it uses enzymes to remove glucose molecules from the branches. One of the organelles within the cell is the lysosome, which functions a bit like a tiny recycling plant. The lysosome contains enzymes that break down cellular substances so they can be recycled. Now, for some reason, and it's not really understood why, but small amounts of glycogen end up in the lysosomes, where it's broken down by an enzyme called acid alpha-glucosidase to release glucose from the glycogen chain. In Pompe disease, a mutation of the GAA gene prevents the production of enough functional acid alpha-glucosidase, and as a result, lysosomes can't break down glycogen. This leads to a buildup of glycogen within the cytoplasm and the lysosomes, and that leads to cellular damage and destruction. Now, normally, glycogen is found in the largest amounts in the cytoplasm of liver cells, and all three types of muscle cell. In individuals with Pompe, glycogen mostly accumulates in the lysosomes of those cells. Skeletal muscles include various muscles of the body, as well as the diaphragm, which is the primary breathing muscle. Cardiac muscle makes up the majority of the heart, and smooth muscle is found in the walls of blood vessels and many other organs. Pompe disease is an autosomal recessive condition, so in other words, both parents must be carriers. The severity of the condition depends on how much functional acid alpha-glucosidase is produced. If little to no enzyme exists, the infantile form of the condition typically occurs. Within the first few months of life, muscular damage to the heart develops, causing hypertrophic cardiomyopathy, or an enlarged heart, and eventual heart failure. Skeletal muscle weakness causes severely decreased muscle tone of the entire body. Weakness of the diaphragm and other breathing muscles lead to respiratory failure as well. Other findings include an enlarged liver, which is thought to be largely due to heart failure, and a large tongue, which is primarily made of muscle. If there's reduced enzyme, the late-onset Pompe disease, also classified as juvenile or adult onset, can present at any age and varies widely in severity. Usually there's weakness of the proximal limb muscles, like the shoulders and hips, and progressive diaphragm weakness, leading to breathing difficulties. One thing to note is that the heart is not involved in late-onset Pompe disease. Diagnosis includes blood tests like creatine kinase to check for general signs of muscular damage, measuring the acid alpha-glucosidase enzyme activity in either white blood cells or a dried blood spot, and gene sequencing to assess the GAA gene. While it's not necessary for diagnosis, electron microscopy of muscle biopsies often show lots of glycogen in the cytoplasm and lysosomes. Treatment includes enzyme replacement therapy with a manufactured form of acid alpha-glucosidase called alpha-glucosidase alpha, which helps remove the accumulated glycogen from the lysosomes. There's also supportive therapies like mechanical ventilation, physical and occupational therapy, or placement of a feeding tube. Alright, as a quick recap, Pompe disease is an autosomal recessive condition caused by a mutation of the GAA gene that results in insufficient lysosomal acid alpha-glucosidase. Lysosomes can't break down glycogen normally, and its buildup damages muscles and other cell types. The infantile-onset form is characterized by early development of hypertrophic cardiomyopathy and respiratory failure, while late-onset cases do not involve the heart and can present at any age. Diagnosis includes a blood test to measure GAA enzyme activity, while treatment includes enzyme replacement and supportive therapy.